Our setting finds us at the post-surgical acute care unit at the University Hospital in Anywhere, USA. Our patient, Mr. Anderson, who has just arrived on the unit.
Hello, Mr. Anderson. I'm Nurse Jackie. I'll be taking care of you while you recover from your surgery that you had this morning.
Hello.
I'm just going to do a quick assessment of your incision, and then I'll go get your pain medication, okay?
Nurse Jackie is noting that the incision looks as expected. No redness or pus, the edges are neatly approximated, and the sutures are holding nicely. She does note that Mr. Anderson has 2 drains sutured in place below the incision, one of which is filled with serosanguinous fluid. The other, however, is filled with frank blood. She empties the drains.
Mr. Anderson, are you in any pain?
A little, maybe a 5 out of 10.
Okay, thanks. I'm just going to step out and go get you some Tylenol.
Nurse Jackie charts the drainage amounts and makes a mental note to keep close watch on the amount of blood draining into drain number 2. She's a bit concerned that after his surgery, Mr. Anderson might be bleeding more than expected.
Mr. Anderson, here's your Tylenol. I'm just going to have another look at this drain.
Nurse Jackie notices that in the 20 minutes that she has been out of the room, Mr. Anderson's second drain has filled with another 25 mils of frank blood.
Okay, Mr. Anderson, you try to rest, and I'll be back to check on you in a little bit.
Nurse Jackie returns to her charting and sees that there are some new orders to be acknowledged. Nurse Jackie is wondering why the prophylaxis dose is being ordered due now. Usually DVT prophylaxis is started the morning after surgery, not the day of, and Mr. Anderson is actively bleeding. Nurse Jackie decides not to give the medication. She decides to speak to the physician instead.
Dr. No, I was wondering about this heparin order for Mr. Anderson. He is draining frank blood, and I'm concerned about anticoagulation therapy at this time. Do you have a specific reason for starting this medication today instead of tomorrow?
No, I put that order in for tomorrow. The pharmacy's always making mistakes.
Here we can see an error has been made. A medication that was ordered for one date was entered for another. Dr. No's reaction was a bit blaming, but it is important to highlight the danger of mistakes like this.
I got to call the pharmacy. This is Dr. No. I'm calling about my heparin order for Mr. Anderson. I put that order in for tomorrow, but it came through for today.
I'll look into that, Dr. No. Would you like me to retime the medication for beginning tomorrow a.m.?
Yes, please. Jackie, thanks for catching that. I'm going to examine Mr. Anderson now.
Oh, this is the 3rd time this week we've had a heparin DVT prophylaxis ordered set time for the wrong date. Do you think we need to look into this? Absolutely! We need to get to the bottom of what's happening, or we might have some patient harm. We're all here today to get to the bottom of these medications timings errors. I'd like everyone to look into their protocols and procedures to see if we can find out what's happening here. We cannot continue to have these types of errors.
Good thinking. I'll speak with my team.
Yeah, and I'll talk to the nursing staff as well.
How did everyone's research into these errors turn out? Well, it turns out that we have a procedural problem with DVT prophylaxis we didn't know about. What was it? When the patient is prepped for surgery, the residents write up all the orders based on the surgical date. If the patient's surgery gets pushed, the dates only get adjusted if the same resident team is on the floor. Why? Somehow, it gets missed in the handoff. What is your plan going forward? How are you going to address this and ensure that it doesn't happen again? We're going to redo our procedure so that the order sets are placed but suspended until after the surgery takes place. And we are adding a line to our handoff note. And how about the pharmacy?
We discovered a problem.
Oh, really?
We don't check the patient's history to ensure that surgery has taken place, and the order sets don't come through on epics stating that the heparin is for prophylaxis.
And what are you going to do about it going forward?
We're going to have an epic change so that when prophylaxis is ordered, it will say so and prompt us to verify the surgery date.
We also have an issue in nursing in that we have some intimidation and several nurses don't feel they can speak up to the surgeons. I think if we make a presentation to the staff about how these errors were made and how we work together to fix them, it will send a message that patient safety is more important than ego.
I think that is a great idea. I would like the surgical team to attend. We can further break down the hierarchical nature of the unit if we all participate and acknowledge our part.
Great! I will develop a PowerPoint and schedule an education day.
Great work, team! Yay!